Good evening, Chair Prada, Vice Chair Archambault, and members of the Senate Committee on Judiciary. My name is Tim Appleton. I'm the Field Director for Compassion and Choices. I'm before you today on behalf of the thousands of Rhode Island supporters who are in favor of aid in dying and S320, the Lila Sappinsley Compassionate Care Act. Further, we'd like to thank the leadership of Representative Ajello, Senators Goldin, Coyne, and Ewer for their leadership on behalf of this issue. Terminally ill Rhode Island residents want the option to use medical aid in dying if their suffering becomes too unbearable, are not deciding to die. A disease is already taking their life. They're merely deciding, as my colleague just said, to avoid the very worst, the very last part of the dying process. Medical aid in dying is entirely optional for doctors, other healthcare providers, pharmacists, and the patient. Since this bill was last before you, public demand for this end-of-life care option has only continued to grow. There are 5 new jurisdictions who have authorized this practice in the last 4 years alone: California, Colorado, the District of Columbia, Hawaii, and just a few weeks ago, New Jersey. Today, over 1 in 5 people, over 20%, now live in a jurisdiction where medical aid in dying is an available end-of-life care practice. The momentum for this issue is self-evident. The legislation, as I'm sure you've heard, is modeled after the 1994 Oregon Death with Dignity Act. The bill includes the same strict eligibility criteria and core safeguards that have been time-tested and proven to protect patients. The dying person is in charge of this process from start to finish. They request the medication multiple times, orally and in writing, and they must be able to self-ingest it. In more than 40 years of combined experience across 7 states and Washington, D.C., there's not been a single legally documented incident of abuse or coercion. In fact, in 21 years in Oregon's history on this law, less than 1,500 people have used it to peacefully end their suffering. That's less than 1% of the state's annual deaths. While you may hear tonight opponents come up with worst-case scenarios and hypotheticals, the concerns they raise simply have not been borne out in data and evidence. And here's some evidence. A Journal of Medical Ethics report concluded that assisted dying did not pose any heightened risk for any population, including vulnerable populations. Another, a New England Journal of Medicine study concluded that insurers have no financial incentive to pressure patients to accelerate their deaths. The evidence also demonstrates that while few people relatively will access these laws, far more will benefit by simply knowing the law exists, and because the implementation of these medical aid in dying has resulted in more candid conversations between doctors and patients, higher hospice usage rates, and improved palliative care training for physicians and other healthcare providers. In the end, the debate quite simply comes down to who decides how much pain and suffering is enough. The dying person in consultation with their loved ones, their physician, and perhaps a faith leader, or the government. Terminally ill Rhode Island residents don't have the luxury of endless deliberations. They need this compassionate care option now. We urge passage of S320. Not a single additional person will die if you pass this compassionate bill, but far fewer will suffer.